Joining us now this morning to talk a little bit about the numbers at Salem Regional Medical Center and some of the other things that have been going on since we've been on the air. Dr. Robert Underwood is joining us from the hospital. Dr. Underwood, good morning. Thank you for being with us.
Good morning, Scott. Good morning, Megan.
Morning. So why don't you give us an update on the current status of our census and what the trend is over there?
Sure. And so what we're seeing is some still very high numbers as far as our hospital is concerned. Our current census is 170, which is a lot higher than it normally would be. We've got COVID positive patients that are either COVID positive or they're still waiting for a test result to come back. Our ICU has 13 patients in it. We only have 14 beds in our regular ICU. Those are all now COVID beds. 9 of those patients are currently on ventilators. So very, very high. We've actually doubled up on some of the regular patient rooms so that we have multiple patients in single patient rooms just because we need the space. So that's something that we're experiencing. What's been interesting is I've been on 3 different state level calls so far this morning. The rest of the state is feeling significant decreases in the number of COVID patients. Now everybody is anticipating that we will see a surge over the next week to 10 days because of the Christmas holidays. There's usually a delay in the lack of social distancing and what impact that has on the number of cases. We saw it after Thanksgiving. It wasn't as bad as we thought it might be. We're expecting the same type of thing after Christmas. We'll see how bad this is. I've had actually personal, not me and my family, but personal friends of mine that have had impact because of visitation during the Christmas holidays. So we don't know what we're going to see around that, but we do anticipate seeing some numbers go up.
Yeah, that's concerning. And so if the rest of the state is doing slightly better with their census, would this be a case where we might start transferring our folks to other places, or just given the speed of the virus?
It is something that is always open, and it depends on kind of the type of patient. ICU patients, often we would transfer those if our ICU gets overly full. Now, one of the things that was also said was that even though the COVID numbers may be going down, the total patient volumes are not necessarily going down. Very interestingly, it was highlighted that there were a number of trauma patients that were actually transferred into the University of New Mexico for ICU care and other care over the course of the last 24 hours or so. So it seems that we may be improving in one area, but we're feeling some strain in some other areas.
Interesting. And so, Dr. Underwood, it sounds like we are nearing capacity at the hospital, and so that concerns all of us, obviously. And we know we've talked to you and others about the hospital still being open and encouraging folks to still go and see their primary medical provider and all those services that still are ongoing. You still have to treat these other patients in addition to these COVID patients, right?
Yes, absolutely. We have a few slight restrictions right now. We're not doing elective surgeries if it will require an overnight stay in the hospital to try to preserve that inpatient bed capacity. That really seems to be where the strain is right now, is that inpatient bed. We do have, of course, staffing is one of the things that is strained in these types of circumstances. Over the course of this week, we have a number of traveling nurses. These are nurses that have licenses in multiple states, and then they can come and kind of work as a locum tenens type temporary position. We have quite a number of those starting this week, which is going to expand our capacity a little bit as well. But yes, we absolutely encourage folks to get their regular care, make sure they're getting their usual screening that they're supposed to be getting based on the recommendations of their primary care physician, whether that be colonoscopies, mammograms, vaccinations, etc. All of that stuff needs to still continue.
Good point. And I wanted to ask you, too, about some of the stories we're seeing out of Los Angeles and Southern California, and certainly a big increase in COVID cases there, and that directive to some of the ambulance services that were saying not to transport patients if they didn't think they could be saved at the hospital. Obviously, we're not at that level at all in our area, but as a caregiver, that's just got to be unfathomable that you would put out a policy like that to your frontline medical workers. Can you imagine?
I cannot imagine as a physician, I could not imagine putting that directive out. No, I couldn't. You would have to be really in dire straits if you were going to put that kind of directive out. So we've never considered it. We've never talked about that. We've never been close to any of that kind of circumstance here in San Juan County.
Good to know.
Good to know. Yeah. So, sort of a follow-up on that is regarding visitor policy, because that's ebbed and flowed with the situation as well. What is the updated visitor policy now?
So I would have to direct you to our website. Yes, it does change, and it changes periodically depending on what the level of COVID cases that we're seeing. In-house, of course, we still, for pediatric patients, parents can visit. For newborn deliveries, there are differences in visitation. But for the COVID floors especially, there are some restrictions because we really don't want to endanger visitors. We don't want to endanger staff members, et cetera. So I would direct people to our website to see what the most current is, because it does change periodically. In fact, I think we've got a meeting later this afternoon to talk about that very subject.
Gotcha. Interesting. Well, it does change, and so the website's probably the most up-to-date place to go if things are changing minute by minute, which they could very well be in these situations. I wanted to ask you too, Dr. Underwood, about the vaccine that is out and being distributed to frontline workers and healthcare workers, and there's a specific order that the state is trying to get this vaccine into people's arms, of course. But folks shouldn't be calling the hospital to try to get an appointment to get a vaccine, right? They should go through the state's website that's been set up to kind of manage this, correct?
That is absolutely accurate. The website is vaccinenm.org with no spaces between them. And it really is a place where you can register. We registered my wife, for example, through that website. And you register, and it will put you into the appropriate categories based on the priorities in the supplies that are available. Frontline healthcare givers are the first people that are on that list, and it's broken into kind of sustainability of what we are trying to do to fight the infection, and the other is those that are the higher risk of people, if they get it, would be more medically impacted. So long-term healthcare residents, people that live in nursing homes, they're in one of the top priorities. And then as you go down, then phase 1B, that is what we call phase 1A. And then 1B is broken into frontline essential workers and people 75 years and older. Again, looking at it in two different phases. One is sustainability of the operations and taking care of the pandemic versus looking at those people who are at greater risk of a significant medical impact. And it works its way down through the system that way, trying to make sure that we can still continue the fight. Obviously, if we have a slew of emergency department nurses, for example, who end up on quarantine, that would greatly affect our ability to care for the other COVID patients. That's why they're high on the priority list. Likewise, elderly people, as we know, are at higher risk of having a more significant clinical response to the COVID-19 infection.
Sure. And I want to go science nerd here a bit because I like to take every opportunity I get for that.
Hang on, everybody. Here we go. Buckle up.
Buckle up. So, no, I want to talk about these variant strands we saw in England and then in South Africa. They've both had different types of strands. Actually, there's multiple, it seems. And so,
in Colorado, I can see it in a couple states here.
Yeah. So, can you give us a little bit of insight into that?
Yep, so I can, and thanks for the question. So Brazil also has now identified another variant in the strand, and these are variations in the sequence. If you remember, we've talked about previously, so these are RNA, essentially is what codes for the spike protein. Spike protein is what binds to part of your body, primarily angiotensin converting enzyme receptor. And that's what we're targeting with our vaccine. That's how your immune system seems to be responding to it. In the UK, and yes, there's in one case in Colorado, at least one that I know of that has been documented, that was the UK strain, there is a single RNA nucleotide that is out of sequence, but it still binds to the angiotensin converting enzyme receptor. In South Africa, there are 3 nucleotides that are mutated in that particular variant. Now, one of the things that they're finding is it seems to spread faster or has a higher propensity for spread, and they don't really know why yet. So I have said before that science is an accumulation of data over time. And so we need to accumulate more data, and we certainly need more time to analyze that data so we understand what it really means. So I do not know in terms of the Brazil variant what that mutation is, but that's what we're seeing between South Africa and the United Kingdom.
And Dr. Underwood, there's still some pretty good science and agreements in the scientific community that the vaccines that have been developed and that are being rolled out should still be effective against some of these variants of the original COVID infection, the COVID virus, correct?
So what we are hearing is that the science is saying that is probably and relatively assured to be the truth, yes, that it should still work with that particular one. I did read an article just yesterday that was talking about a possible decrease in the efficacy of the Johnson & Johnson vaccine. Now, remember, the Johnson & Johnson vaccine that is coming out is actually based off of the old methodology that we use for vaccine development, and that is to grow the virus and then develop an immunological response based on the real virus, which is attenuated or broken down in some way. Only that one was implicated in this article as possibly decreasing how effective that virus or that vaccine may be against the new strain. I did not see anything about the mRNA vaccinations and showing those to have any level of decreased efficacy.
And those are the vaccines that are currently being distributed, not the Johnson & Johnson, to my understanding.
Correct. And so what you will often hear is Pfizer, and these are just the drug companies that made them.
Right.
So the Pfizer vaccine was the first one that has come out. We are now entering into week 4 of administering the Pfizer vaccination here at the hospital. Moderna is the other company that is also an mRNA vaccination, and it is being distributed and administered in a number of places already. As a matter of fact, I know Walmart, through the website that we just talked about, where you can go in and register, they have started to administer that vaccination, the Moderna vaccination, to those that qualify based on their priority group.
Very good. Well, as always, Dr. Underwood, thank you so much for joining us. It's always a pleasure to speak with you, and you're very articulate, so thanks.
We appreciate that, yes, indeed. Thank you, sir.
I wanted to point out one other thing is we do have a monoclonal antibody clinic that we're running. That's another type of therapy. We're doing that 3 times a week. That the end point of that treatment is to prevent hospitalization. And so if someone has COVID and they meet the requirements, talk to your primary care physician, because that is something that you can come in, get an IV infusion, and there's a statistical reduction of requirement for hospitalization. People that meet those requirements, primarily it's people with comorbidities, other types of illness, or age that would qualify for the monoclonal antibody therapy. And Megan, sometime off the air, we can talk about how monoclonal antibodies work, because it would thrill you in your nerding out of the physiology and immunogenicity of how this works.
What a tease.
She's already there. She's already there.
Yeah, I'll be like sending you an email immediately after this.
That sounds great. And once again, I have to, give my kudos to the entirety of our community, the teamwork of our healthcare professionals, at our hospital, with our EMS services, police, fire, the team across the entire community has just had an incredible response. We could not ask for more. I wouldn't want to be anywhere else fighting this kind of battle.
Well, I think it's a good point, and we appreciate all their work and yours as well, Dr. Underwood, all your folks on the front lines. Thank you for keeping us all safe, and we appreciate it.